Hi, my name is Renika Maharaj. I'm doing my clinicals at Sacramento Community Clinic. It is a family clinic in Sacramento, California. The case that I have for my signature assignment is regarding a pleasant 11-year-old South Asian female who presents to the clinic accompanied by her mother with complaints of a sore throat. I found this interesting. I just find cases interesting when I can relate to them. And as a kid, I constantly had sore throats, tonsillitis, and it was crazy because I feel like the doctor didn't have me get a tonsillectomy till I was much older, even though I would have chronic tonsillitis in my early teens. I didn't get my tonsils removed till I was 24, which is super late for most people. So I feel like just see a case where they were kind of going through the same thing is when I find it interesting. So my patient, her initials are SS, date of birth January 1st, 2012, age 11, race South Asian, gender female, marital status single. Her, as I mentioned before, subjective. She's South Asian female, presents to the clinic accompanied by her mother with complaints of a sore throat. Patient is dressed appropriately and able to answer questions with the assistance of her mom. Patient's mother appears to be a reliable historian. Her chief complaint is, my throat started hurting like 3 days ago and it hurts a lot and it's hard to swallow because it hurts so much. HPI, SS, an 11-year-old South Asian female, was brought to the clinic by her mother due to discomfort in her swallowing, which began 3 days ago for throat pain. The mother says that her tonsils have swollen, which she noticed yesterday, and the patient said that the pain is kind of isolated to the voice box area and the tonsils. And she noticed that her voice is also sounding a little bit more hoarse than normal. The patient said that swallowing foods and liquids does cause the pain to get worse, but it's makes it a little more tolerable when she eats bland, smaller meals. She's been taking lozenges to help with the pain. It helps a little bit, but not much. Besides that, the patient is in good health. The mother has no other concerns besides the throat. She had her regular dental exam done earlier that year, and there was no issues. Medical problem list, the patient does not have any medical issues at this time. For preventative, her last wellness exam was May 18th. Last dental exam, May 18th of 2023 for the wellness. Dental, June 2nd, 2023. Last vision test, June 18th, 2023. Per the mom, the patient has never had any surgeries or been hospitalized before. For immunizations, patient is up to date on all immunizations. She received the flu shot October 12th of 2023, and she has received the COVID vaccine plus booster. She has no current allergies to foods, drugs, or environmental factors. The only medication she's on is the lozenges, 1 tab every 4 hours by mouth for sore throat. So for the ROS, the patient denies the patient and her mom deny any weight loss, general body weakness, fatigue, chills, or fever, denies any nasal discharge, dysphagia, epistaxis, or blurred vision. She did acknowledge that she's having trouble swallowing. There is some edema in her throat, the sore throat, tonsil swelling, and hoarseness in the voice. No complaints of rapid heartbeat, palpitations, edema. No complaints of cough, chest pain, wheezing, or shortness of breath. Denies nausea, diarrhea, vomiting, constipation, and no dysuria, frequency, hematuria. There's no complaint of muscle or joint pain, no joint stiffness, no complaints of vertigo, headache, vision changes, or seizures. There's no rashes, itching, or skin issues per patient and her mom, and no need for extra time to recover from illnesses. For vital signs, her heart rate is 94 beats per minute, blood pressure 104/64 sitting right arm, temperature 98.4, respiratory rate 16, O2 sat is 100% at room air. She's complaining of throat pain, a 4 out of 10 on a scale of 0 to 10. Her height is 4'7", weight 88.6 pounds. Her BMI is 20.6. Upon physical exam, the patient is alert, cognizant of time, place, and people. She's speaking appropriately and is a skilled historian. Her Eyes are equal, light responsive, normal, moist mucosa in the nose, extraocular movements are intact. Her head is normocephalic. There's no lesions, bumps, or bruises on the patient's head. Upon palpation of the lymph nodes, the patient did complain of soreness. She is noted having issues swallowing. There's no cyanosis in the mouth or pale or cherry red tinted areas. Lips are symmetrical, smooth, and moist. No growth or bumps are present. The buccal mucosa seems wet and pink, and the tonsil just looked inflamed and red. So no complaint, and there was no wheezes. Lung sounds were clear to auscultation. Her heart sounds were normal. S1 and S2 were presented. Abdomen, normal, active, positive for bowel sounds in all four quadrants. Soft, non-tender, non-distended. No cyanosis or clubbing noted. No intact 1 to 12 cranial nerves, functioning sensory motor systems, and she's able to move all her extremities. Her grip strength is 5 out of 5 bilaterally, and lower and upper extremity strength are 5 out of 5 bilaterally. Her skin is dry, warm to touch, it's intact, no rashes, bruises, or lacerations. No musculoskeletal abnormalities. All her limbs, she has complete range of motion, no joint pain or joint swelling noted. All right, and then for my differential diagnosis, the first one I have is acute epiglottis. I used a journal by Conoet from 2018, and they just said that the symptoms of acute epiglottis include hoarse voice, fever, restlessness, stridor breath noises, breathing difficulties, and swallowing issues. Sorry. So the patient does have some of those, but she does not have a fever or restlessness or stridor, so we can rule that out. My next differential diagnosis is a retropharyngeal abscess. I used a journal by Janet from 2021, or Jane, sorry, and others. There's a bunch of others. And I got this differential because the patient is having difficulty swallowing and pain. But other things that are also manifested with this are neck stiffness, soreness, and muted voices in children, and our patient does not have that upon physical examination. My last differential diagnosis is tonsillitis, and I chose this because the patient has sore throat, difficulty swallowing, red swollen tonsils. She doesn't have a fever or white spots on the throat, which would usually indicate strep throat. So my diagnosis for this patient is tonsillitis. The plan for labs and diagnostic tests, we are going to do a rapid strep test, throat swab culture, complete blood count, just to see if there is any bacterial infection. If there is, then we would go ahead and prescribe her some antibiotics. If not, for medications, just continue using the lozenges with benzocaine every 2 to 3 hours needed for pain. Also, Tylenol, 160 milligrams every 5 ml. Take 15 milliliters by mouth every 4 hours as needed for pain or fever. And the patient is not to exceed 5 doses in 24 hours. So patient education is for the patient to sip on chilled beverages or nibble on fruit-flavored frozen snacks. Drink plenty of fluids, preferably warm, not hot. Take ample fluids to hydrate the throat. Use warm salted water to gargle, resting the voice, and sleeping enough. We're going to follow up with the patient once we have the lab results and review with the patient and her mom. And then we can have the patient follow up if symptoms worsen or do not improve in 72 hours. Thank you.